It's great to have you. And those of us that will be seeing this after we have the news conference, I appreciate your support of the Delaware County Health Department. We did have a change in our schedule this morning. Dr. Monica Taylor is not able to join us to do her opening remarks. However, I have them, so I will be playing the role of Dr. Monica Taylor as well as the Delaware County Health Department Director. So bear with me as I go through her talking points. I think there's some important concepts here that I did not include in mine. So she wants to thank you all for being here. A special thank you to Phil Wayball from MVP Recovery. You'll be hearing more from him as well through our press conference this morning. So we're here to announce free life-saving resources and training through our new Delco Revive program. This program is coordinated by the Delaware County Health Department, and it's funded through the county's opioid settlement funds. How did we get here? In September of 2022, Delaware County Council announced a historic $62.5 million in opioid settlement funds. This was from pharmaceutical distributors. The settlement resulted from the combined legal actions taken by county, state, and the district attorney. As a result of the settlement, Delaware County will receive annual payments for 18 years, averaging about $3.5 million per year. This will be used to tackle the devastating opioid epidemic affecting Delaware County residents, their loved ones, and the community. To ensure that these funds are used effectively, we formed a task force to provide recommendations for short-term uses and immediate uses, as well as long-term programming supported by the new funding. Delco Revive emerged from this task force and is just one way in which we are using opioid settlement funds to combat the opioid epidemic in Delaware County. Delco Revive focuses on education and the distribution and prevention materials to organizations, schools, businesses, and individuals in our community. I'll talk more about those in my talking points. The Delaware Revive program is life-saving in our community, and I want to stress that this is a program that is helping the entire community. After all, we know that opioid addiction affects residents of all ages, races, genders, and peoples from all parts of our county, as well as across the country. Addiction has no boundaries. It's important that we work to reduce the stigma. This is a public health crisis. We all acknowledge that. And we need to tackle it head-on without judgment. So I want to thank the Delaware County Health Department for their lead on the task force. I sit on that task force, and the invaluable work that that task force does for everyone. So thank you, and I will introduce Director Lyon. Well, thank you, Dr. Monica Taylor, for your comments and your nice remarks. We're glad to be here this morning with all of you. So, on a serious note, I want to take just a moment to acknowledge that there's lives that have been lost in Delaware County to the opioid epidemic. And that's real. And there are those that are struggling with many types of substance disorders. Anyone watching today, I want you to know that you're not forgotten, your families are not forgotten, and you are why we are here today. You're here so that we can learn how to save a life. Every day in Delaware County, every day here at Delaware County Health Department, we strive to prevent, promote, and protect. What does that mean? Our mission is to prevent injury, illness, disease, and premature death. And we do that through the promotion of healthy behaviors, the protection of our environment, and the prevention and the spread of disease and illness. We prevent, we promote, we protect. We are people serving people. Delco Revive is a core example of how we strive to prevent premature death. We do this by giving Delaware County residents the tools and access to learn how to save a life. The program focuses on education and the distribution of critical resources in the event of a life-threatening emergency. Delco Revive offers free harm reduction techniques that include free Narcan nasal spray, also known as naloxone, fentanyl and xylazine test strips, and wound care kits, as well as life-saving hands-on only CPR and stop the bleed tourniquet training with health department professionals. Narcan spray or naloxone is an overdose reversing medication. It's easy to use and can save someone's life instantly. Fentanyl and xylazine test strips are inexpensive drug testing technologies, so people understand what's in their drugs. They can detect any level of fentanyl or xylazine in a substance in seconds. All of these tools are available at our 3 locations of Delaware County Health Department: Chester, Yeadon, and Eddystone. CPR certification and Stop the Bleed training appointments are available for free through the Delaware County Wellness line at 484-276-2100 or by email at delcowellness@co.delaware.us. I think it's fair to say we all know someone that struggled with substance use. We all know someone, whether it's a family member, a sibling, a friend, a colleague. We've all been touched by this in some way. And if there's anything I hope for you to take away today, other than the awareness of the Delco Revive program, is that there is hope. And even when it seems unlikely, recovery is possible for everyone. Because if you have hope, you have a chance. If you have a chance, you have a life. Narcan gives the gift of one more day of life. Today, you will get to watch a testimonial video for someone whose life was saved by the use of Narcan nasal spray. You will hear how at least it kept them alive for one more day and afforded them the time and the opportunity to choose to get help. We may never know if and when that day will come that someone struggling decides to seek recovery. It is our responsibility to make sure that we carry tools to give a gift of one more day of life. The Delco Revive marketing campaign also aims to end stigmas regarding substance use disorders, finding help, and recovery options. This was very important to me personally. I wanted to destigmatize our conversations that we have around substance use disorders in our communities and across our country. So I'm grateful that we are aiming to destigmatize how we discuss substance use disorders, people that need to find help and are seeking recovery. The harm reduction resources like carrying Narcan and nasal spray by everyone is one way that we can destigmatize. What else are we destigmatizing? To start, we destigmatize that you can harm someone, so there's a stigma that you can harm someone and get into trouble for administering Narcan or for taking other life-saving emergency actions. First, Narcan nor these trainings will harm or injure anyone who is experiencing an overdose or life-threatening event. Second, medical and non-medical civilians are protected by the Good Samaritan Act, which safeguards anyone who renders emergency care, first aid, or rescue at a scene. There is also a stigma that you do not need to carry Narcan or naloxone because you or your friends or your families don't have substance use disorders. Well, I'm here to tell you that's not true. Carrying Narcan and naloxone is not only about saving the lives of people we know, it's about having tools available to save a life of somebody at any time. That is why we say, be a good friend, be a good neighbor, be a good stranger, and save a life. You have heard the term substance use disorder a few times. That's because labels like drug users or addicts are harmful and cast those suffering as irredeemable. Hopefully, after hearing our next speaker, who is a survivor, and seeing his testimonial, we can deconstruct the stigma associated with people experiencing substance use disorders. I'm going to add in here that I thank this gentleman very much for his courage to be here with us today and tell his story for all of us and helping us destigmatize substance use disorders. We want to show that recovery is possible for everyone. Lastly, if you are still unsure if you should carry Narcan or naloxone, I ask, what if you had to save your loved one? Or what if someone else needed to save your loved one? Would you want them to have Narcan and naloxone available? Would you still want them here today? What would that mean to you? We want to end the stigma. We want to encourage that you carry Narcan or naloxone. We want to learn how to save a life through Delco Revive. We're here for you. So thank you for allowing me to have this much time with my talking points. And at this moment, I'm going to bring up Phil Wabel from MVP Recovery, the most courageous person in the room today. You can adjust that mic to your height.
All right. Thank you, guys. Thank you, everyone that's here to assist and to help in the distribution of Narcan. Yes, there is an opioid epidemic here in Delaware County and in Philadelphia, but I'm here to share that there is also a recovery epidemic happening in Philadelphia and in the surrounding suburbs. And I've been charged with the task here to share a little bit about my experience. And when I rewind the tape a little bit and when I look at the fulcrum that balances life and death within someone who is actively addicted, Narcan was, and I say this very sincerely the catalyst that tipped the scales in favor of life over death, for me, in my experience, in battling an opiate addiction. So my testimony is an interesting one. It was a story of addiction that lasted several years, and it really manifested after my time at university. I'll skip kind of towards the end. So the disease of addiction progressed to the point in my life and in my story where I lost the girl, I lost the job, my career, I lost the house or the apartment. I was evicted from my apartment, and as a young man, I had to move back in to my parents' house. And I remember kind of looking around and thinking, you know, I'm viciously addicted to these substances. I really got nothing going on for me. And so I made a conscious choice to go out, and I overdosed. And the next thing I remember is waking up with EMTs hanging over my head, telling me that my life was just saved and revived by Narcan. And unfortunately, I felt very angry at the time. I felt like, you'd think I would be very grateful, but I was angry and I was displeased with my life and where I was at. But it was the Narcan that allowed me one more day of life that I could surrender to the addiction and pursue services, pursue help, and receive that help. And so last Thursday, I was graced with the opportunity to graduate from Widener University with a master's degree. And thank you. And today I've dedicated my life to helping those in addiction. I'm a substance use counselor. I work with law enforcement and police to help people who are struggling with addiction access treatment. And life could never be more full. I couldn't imagine this in my most wild dreams. So I thank all of you, and I would encourage you to continue the spread and the support of Narcan and its utilization in the community. So thank you.